Heart disease is the #1 killer of women in the United States. It's best for women to get heart disease detected early.
Yeah, and there was a new study showing where a simple blood test can actually help predict heart disease risk. Here to talk a little bit more about this is our health expert, Dr. Payal Kohli. Dr. Kohli, good morning.
Good morning.
All right, tell us a little bit about this study.
Oh my gosh, we were so excited. So this just came out of the European Society of Cardiology meeting. And what the study did is it looked at 40,000 women. And the study is 30 years old. So this started in the early 90s.
Wow.
Checked their blood test as a one-time test, 3 different markers that we'll talk about. And 30 years later, it predicted heart disease and strokes. So now we're talking about looking into the future, and some of these women were as young as 40. So what we're realizing is that heart disease starts early in life, in your 20s, 30s, and 40s. And if you start checking the right things at that time, you can actually predict what's going to happen many years later and hopefully change the trajectory.
What's scary about that is so many people say, oh, well, I'm young, you know, we brush it off
Right.
because of our youth, and now, ooh, that kind of changes the game.
Yeah, so these blood tests not necessarily new. Are they easy to get though?
Very easy to get.
Okay.
In fact, your doctor has access to them. So there are 3 blood tests, and I want you guys to write these down as well because I want you to get them too. So the first is the LDL, which is the bad cholesterol. That's just like your cholesterol test, something we're used to getting. But that in combination with the second test, which is a CRP, C-reactive protein. So that's a marker of inflammation in the arteries, combined with a third test called a lipoprotein A, which is a fat in the blood. It's largely genetically determined. So that 90% of that is genetically determined. It's not influenced by diet or anything. These 3 tests together, which are readily available, inexpensive, not new tests, they've been around for decades, really sort of help us realize that there's this explosion being set off inside your arteries. The inflammation, the fat kind of all mixed together to start to create some of those cholesterol blockages.
So beyond the blood test, though, are there other ways that can help detect heart disease?
Yes, and here's where our approach has also changed. So we used to say, let's sit on our hands, wait for heart disease, which is the #1 killer of men and women, to declare itself, and then we think about looking and seeing how much heart disease you have. Now our approach has gotten more proactive, where you can get an X-ray of the heart called a calcium score. It's $100 out of pocket. I would recommend anyone over the age of 40 to get it. Under 40, it's not as good at predicting because it takes a while for that plaque to deposit, but it's a quick X-ray, it takes 5 minutes, and it tells me if you already have heart disease. So, you know, I can actually look into the future and not wait for your heart attack to declare itself, but start to change your medications and really change your risk. And this is where that 80% of heart attacks and strokes being preventable, you know, using blood tests and imaging technology, we're realizing we're getting smarter at looking at those.
You were talking about those 3 tests. I recently had my blood drawn.
Oh, did you?
I had
Yeah.
you check it
Yeah.
out for me, and they were right there on it that you can order them very easy. You're right. It is so easy to check out what your numbers are at a young age. So what advice do you have for women or men if they're a little bit concerned about this?
So I would say that you have to take control of your health because statistically speaking, this is the most likely thing that's going to happen to you. And again, it's so preventable and modifiable that unless you check your numbers, and we at the American Heart Association say, know your numbers, know your risk. Otherwise, you have a blindfold on. So go get that blood test. If you're over the age of 40, go get that calcium score. Your doctor can order it. You can even self-order it, actually. You can call up the facility and say you'd like to get it yourself. And if any of that comes out positive, sit down and talk to your doctor about cholesterol medicine, about baby aspirin, about all the things that we have in our toolbox that can help reduce your risk of this really devastating condition.
All right, great advice right there. I mean, I was starting to write down some notes. I need to go get those tests
Well, you'll
done
have to report back because Corey already
myself.
had it.
I know she did. All right, she's beating me. Dr. Kohli, thank you very much. By the way, you can find all of Dr. Kohli's appearances at 9news.com/Dr. Kohli.